So let us first define what echocardiography is. Echocardiography utilizes ultrasound to produce images of the heart and vascular structures, and also to provide information about the direction and velocity of blood flow within these structures. While ultrasound refers to sound waves with a frequency well beyond the range of human hearing. Echocardiography utilizes properties of sound wave interaction with human tissue. The sound waves are sent through a device called the transducer and are reflected off the various structures of the heart. These echoes are converted into pictures of the heart that can be seen on a video monitor. Ultrasound gel is applied to the transducer to allow transmission of sound waves from the transducer to the skin. The transducer transforms the echo, which is the mechanical energy, into an electrical signal, which is processed and displayed as an image on the screen. The conversion of the sound to electrical energy is called the piezoelectric effect. Why is an echocardiogram performed? The test is used to first assess the overall function of your heart. Next is to determine the presence of many types of heart diseases such as valve diseases, myocardial diseases, pericardial, infective endocarditis, and congenital heart diseases. It would also follow the progress of valve disease over time and evaluate the effectiveness of medical or surgical treatments. Abnormal findings in echocardiogram may provide information about, first, changes in the heart size. Weakened or damaged heart valves, high blood pressure, or other diseases can cause the chambers of the heart to enlarge or the walls of the heart to be abnormally thickened. Next is the pumping strength. The measurements obtained from echocardiogram include the percentage of blood that's pumped out of a filled ventricle with each heartbeat, and also the volume of the blood pumped by the heart in 1 minute, which is the cardiac output. A heart that isn't pumping enough blood to meet the body's needs can lead to symptoms of heart failure. Another indication is damage to the heart muscle. Again, echocardiogram would help the doctor determine whether all parts of the heart wall are contributing normally to the heart's pumping activity. Areas of the heart wall that move quickly may have been damaged during a heart attack or is receiving too little oxygen. Next are the valve problems. So the tests can help determine if the heart valves open wide enough for adequate blood flow or close fully to prevent blood leakage. And finally are the heart defects. It may also show problems with the heart chambers, abnormal connections between the heart and major blood vessels, and complex heart defects that are already present at birth. No risks are involved in a standard transthoracic echocardiogram. The patient may feel some discomfort from the transducer being held very firmly against the chest. The firmness is necessary to produce the best images of the heart. In a transesophageal echocardiogram, the patient's throat may sore for a few hours after the procedure. Rarely, the tube may scrape the inside of the throat. The oxygen level will be monitored during the examination to check for any breathing problems caused by sedation medication. For the examination protocol, in pre-test, there would be no special preparations necessary for a standard transthoracic echocardiogram. The patient can eat, drink, and take medications as they normally would. While in transesophageal echocardiogram, the patient will be asked not to eat for several hours beforehand. During the procedure, for a standard transthoracic echocardiogram, these are the roles of the echo technician who will be performing the procedure. First is to ask the patient to lie on an examination table or bed. Next, the technician will attach sticky patches, the electrodes, to the body to help detect and conduct the heart's electrical currents. The technician will also apply a gel to the transducer that improves the conduction of sound waves. Next, the technician will move the transducer back and forth over the chest to record images of sound wave echoes from the heart. The patient may hear a pulsing sound, which is the ultrasound recording the blood flowing through the heart. The patient may also be asked to breathe in a certain way or to roll onto the left side. An echocardiogram may use several special types of echocardiography. First technique is the M mode, that stands for motion mode echocardiography. This is the simplest type of echocardiography that produces an image that is similar to a tracing rather than an actual picture of the heart structures. M-mode echo is useful for measuring or viewing heart structures such as the heart's pumping chambers, the size of the heart itself, and the thickness of the heart walls. Next is the Doppler echocardiography. This Doppler technique is used to measure and assess the flow of blood through the heart's chambers and valves. The amount of blood pumped out with each beat is an indication of the heart's functioning. Also, Doppler can detect abnormal blood flow within the heart, which can indicate a problem with one or more of the heart's four valves or with the heart's walls. Next is the color Doppler. It is an enhanced form of Doppler echocardiography. With color Doppler, different colors are used to designate the direction of blood flow. This simplifies the interpretation of the Doppler technique. Another is the 2D or two-dimensional echocardiography. This technique is used to see the actual motion of the heart structures. A 2D echo view appears as cone shape on the monitor, and the real-time motion of the heart structures can be observed. This enables the doctor to see the various heart structures at work and evaluate them. Next is the 3D echo technique that captures the three-dimensional views of the heart structures with greater detail than the 2D echo. The live or real-time images allow for a more accurate assessment of the heart function by using measurements taken while the heart is beating. 3D echo shows enhanced views of the heart's anatomy and can be used to determine the appropriate plan of treatment for a person with heart disease. Next are the types of echocardiogram. So the first, as previously mentioned, is the transthoracic echocardiogram. This is the standard type of echocardiography. It is a painless test similar to X-ray but without the radiation. A handheld device called the transducer is placed on the chest and transmits high-frequency sound waves or ultrasound, and these sound waves bounce off the heart structures, producing images and sounds to detect heart damage and disease. There will also be a standard use in the placement of the transducer known as the echo windows. So this includes the following: the suprasternal, apical, subcostal, and the parasternal windows. Another type is the transesophageal echocardiogram. This test requires that the transducer be inserted down the throat into the esophagus. The esophagus is located close to the heart. Therefore, clear images of the heart structures can be obtained without the interference of the lungs and the chest. Transesophageal echocardiogram provides superior image quality, particularly for posterior cardiac structures, which are nearer to the esophagus and less well visualized on transthoracic echocardiography. Next type is the stress echocardiogram. It is performed while the person exercises on a treadmill or stationary bicycle. To visualize the motion of the heart's walls and pumping action when the heart is stressed. It may reveal a lack of blood flow that isn't always apparent on other heart tests. The echocardiogram is performed just prior and just after the exercise. Fourth type is the intravascular ultrasound. This is a form of echocardiography performed during cardiac catheterization. During this procedure, the transducer is threaded into the heart blood vessels via a femoral catheter. It is used to provide detailed information about the arteriosclerosis inside the blood vessels. And finally is the fetal echocardiography. Fetal echocardiogram is the name of the test used to diagnose cardiac conditions in the fetal stage. Cardiac defects are among the most common birth defects. Their diagnosis is important in the fetal stage as it might help provide an opportunity to plan and manage the baby as and when the baby is born.